households in your group to 3 at most and keep windows open and follow all advice on hygiene. I want again today, Presiding Officer, to record my thanks to everyone across the country who continues to do all of this and play their part in helping us through this latest very challenging phase of the pandemic. Thank you very much indeed, and I, of course, am happy now to take questions.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 55 minutes for questions, and I'd be grateful if members who wish to ask a question could please put an R in the chat function. And I call Douglas Ross.
Thank you, Presiding Officer. I welcome the changes to testing rules. These are sensible and proportionate changes that are similar to what we're seeing in other parts of the United Kingdom. I also welcome the changes to self-isolation, which the Scottish Conservatives have been calling for since day one. When they were introduced, we said this policy was not sustainable. Every other part of the United Kingdom made the change, but Scotland was left as an outlier. So, First Minister, why did it take so long to make this change here in Scotland?
First Minister.
I make no apology for considering these things very carefully. My clinical advice until now has been that it was possible that the risks of this in releasing people from self-isolation too early and therefore contributing to a greater increase in transmission outweighed the benefits. That balance of judgment has now changed, and after careful consideration we are making this judgment today. None of these things are straightforward. I would doubt that there is any government anywhere that is making these decisions lightly. They certainly shouldn't be. And sometimes we will arrive at different judgments for good reason. I will always be accountable for and open to scrutiny on the judgments I make, but I will continue to take these judgments really carefully and with the best possible clinical advice. Even today, the changes we are announcing, although I think they are proportionate at this stage in the pandemic because they balance the benefits of isolation with the disruption that isolation caused, they are not without risk. And that is why it's really important that we communicate them properly and that people understand not just what the easing of some of these rules are, but what we are asking people to do in place of these. And that applies to the changes on self-isolation, but it also applies to the changes around confirmatory PCR testing after an asymptomatic LFD positive result. Look, Douglas Ross and I have had exchanges in the past, and I say this non-pejoratively. This is the stuff of Brittany and democracy, but at times in the past, if I had followed Douglas Ross, we would have removed the requirement for face coverings, I think prematurely. We would not have some of the mitigations that we now have in schools that I think are seen to be really important. There have been differences, there will no doubt always be differences, but the trust placed in me, the responsibility placed in me by the Scottish people means that I have, with my ministers, the duty to weigh these things up carefully and, of course, be accountable for the judgments we arrive at.
Douglas Ross.
The First Minister mentioned there that the reason that Scotland remained an outlier was because of the clinical advice she received. So will she publish the clinical advice from last week, which meant this crucial change wasn't made, the clinical advice she has received this week, now the change has come into force? And she also mentioned about communicating properly. Yesterday, the Deputy First Minister, the man who sits in her cabinet in charge of COVID recovery, claimed that virus rates were lower in Scotland compared to England because of the actions taken by the SNP. But John Swinney was using data from before the SNP's restrictions were introduced, and the most recent data shows in fact the opposite of what he claimed. Tackling this virus is not a competition, but John Swinney tried to make it one. So why is the Minister for COVID Recovery using misleading data to make petty political points instead of giving people the accurate information they need?
First Minister.
I don't think that's the case at all, and I'll come on to most recent data in a second. Firstly, though, let me deal with this issue of outlier. When the changes to self-isolation for index cases was first announced, it was only England that it applied to. So for a period, England was an outlier. Last week, I think Wales and Northern Ireland decided to introduce similar changes, and today we are doing likewise. At different times in this pandemic, we've come to different views. substantively. Sometimes we've come to different views, or the same views, on different timescales. Right now, on protections, for example, Wales, Scotland and Northern Ireland are in very, very similar positions in terms of restrictions on gatherings and some restrictions and protective measures in hospitality. England is an outlier on that, not just an outlier in a UK sense, but arguably an outlier in a European and more broadly a global sense. We all have a responsibility to reach judgments based on our clinical advice, and the responsibility we have to keep the public in this most challenging of situations as safe as possible, and that's what I will always do to the best of my ability. In terms of the impact of the protective measures we have in place, it always has been and always will be very, very difficult, sometimes impossible, to prove causation between one measure and the outcomes in terms of virus rates. But I think common sense tells you that if we didn't have some restriction on large, potentially super spreader events right now, if we didn't have measures in place to try to stem, at least to some extent, the transmission in higher risk settings like hospitality, and if we weren't advising the public and the public weren't responding so magnificently well to advice to cut contact, then high rates that we're seeing right now are likely to be even higher, and the pressure on the NHS significant. So we, I think, are right to be trying to apply some brake, notwithstanding the high levels of infection we face. I agree these things are not a competition. At times Scotland's had lower levels of infection, at other times we've had higher levels of infection. Right now, I think the levels of infection are lower. Whether they will remain, that's certainly than England, perhaps slightly than Wales, not so much Northern Ireland, but that is likely to change. My final point would be in relation to the Deputy First Minister's use of the ONS data yesterday. He used the most up-to-date ONS data yesterday. I've cited in my statement today data that, as I understand it, has been published while I've been speaking, that is a week more up-to-date. There'll always be a lag in it, that I think will still show that our 1 in 20, very, very high, is still lower, certainly than England. But these things are not a competition. We just all have to take the decisions and make the judgments that we think are best to try to navigate the safest possible course through that. And I will always seek to do that. I'll be held accountable and subject to scrutiny, and that's the nature of the job that I'm privileged to do.
Douglas Ross.
Well, I'm glad that's the nature of the job that the First Minister is privileged to do, and therefore, hopefully, on this occasion, she will answer my question on clinical advice. It has obviously changed, according to her answer, from last week, when self-isolation rules remained the same, this week when they've changed. So will she agree to publish that? Because data is crucially important. John Swinney said that data from Public Health Scotland would be published today, but the First Minister in her statement has now said that will be Friday. This is vital information on hospitalisations because of COVID and hospitalisations because people are unvaccinated. It's information that's essential for the public to know why they're being asked to put up with restrictions on their lives. It makes it difficult for anyone to judge the COVID situation properly when the First Minister has information, but the public does not. So can she confirm that Friday's update with this information will include all the facts and figures that we've been calling for and that the public need?
First Minister.
I'm not sure it will contain everything the Scottish Conservatives have been calling for, because I think if we'd done everything the Scottish Conservatives have been calling for over the past few months, we would be in probably more of a difficult position than we are now. I've referenced some of the policy issues. We'll continue to take the best judgments we can, and we will continue to publish as much data and evidence as possible on the proviso that there is a confidence in the robustness of that data. We do publish evidence papers. We will continue to publish as far as reasonable and appropriate, the evidence and the advice underpinning the decisions we take. Ultimately, though, these decisions do involve the application of judgment. That's what people elect me and my government to do, to take the responsibility, to weigh up all of the factors and take the judgments and be held accountable for them. So last week, I did not think it was the case that the benefits of changing self-isolation would outweigh the risks. The higher transmission now, the bigger the burden of self-isolation on the economy has changed that judgment. And these are judgments that we will continue to have to make on a whole range of issues in the weeks to come. On the issue about the data that will be published on Friday, Public Health Scotland has been doing that work. It's important that that data is robust. So that data, and that will be the first results of the analysis, that will show the differentiation between those who are in hospital because of COVID, in other words, it's the reason for their admission, and those who are in hospital for another reason, but who have COVID, either they came in with it or perhaps contract it in hospital. That's important information to know. That's why we're doing that work carefully. But it's also important not to put too much store on that. And again, I refer to this in my statement. Just because somebody with COVID is in hospital for another reason doesn't take away the impact of COVID, because the fact they have COVID means that there has to be special infection control measures around that patient in terms of distancing and other things that apply. So that reduces further the capacity of the health service and increases the pressure. So it's important that we understand all these things as our knowledge about Omicron develops, but we shouldn't kid ourselves on that because somebody with COVID is in hospital for another reason, that somehow takes away all of the difficult impact of them having COVID has. So we'll continue to publish evidence, we'll continue to publish data, but I will also continue to do the job I'm elected to do, which is apply the judgment to all of that and reach decisions motivated by my desire, my responsibility to navigate the safest possible path through this pandemic.
Call Anas Sarwar.
Thank you, Presiding Officer. Can I start by passing my condolences to all those that have lost a loved one, and I would like to also put on record my gratitude to our vaccinators, NHS and social care staff, and all frontline workers who have continued to work and keep us safe over the Christmas and New Year period. I welcome the changes being made to the self-isolation period. There will be a relief for public services and businesses who are feeling the impact. I also welcome the broadening of financial support to businesses associated with hospitality, in particular the events, taxi and beauty industry. Issues have been raised about the speed of distribution and the impact that has on risking businesses going bust and people losing jobs. So can the First Minister commit to speedier distribution of these funds? We all agree that we must confront and challenge disinformation online. It undermines public health. But that isn't helped by the government providing unclear or partial information. There is clearly a difference between being in hospital or intensive care with COVID and being in hospital or intensive care because of COVID, especially if there is an outbreak in a hospital. So surely the First Minister is basing her decisions partly on this information. If she isn't, then why not? And if she is, then she must have seen that data and she should share it now. So can the First Minister commit to this data being made available as a matter of urgency so we can maintain public confidence in the decisions being taken and why?
First Minister.
On the first point, councils are responsible for distributing the money we've made available. I know how hard they are working to get that out the door and into the bank accounts of businesses as quickly as possible. And businesses, particularly in the hospitality trade, will be being contacted over the course of this week. So I know councils are doing that at speed and that process will continue. In relation to the second part of Anas Sarwar's question there, I haven't seen the data around Omicron. Previously, data on this question was published by Public Health Scotland in relation to previous variants. I've not seen that data yet on Omicron. I've said in my initial statement the first results of that analysis will be published on Friday, which is as soon as Public Health Scotland consider it will be in a robust state to publish. But lastly, this point which I covered in my answer, well, in my statement and also in my answer to Douglas Ross, yes, there is a difference between somebody being in hospital because of COVID and in hospital for another reason but having COVID. But we shouldn't overstate that difference, because if they are in hospital with COVID, even if the reason for their admission is something other than COVID, the fact they have COVID means that they have to have the same protective infection control measures applied as somebody in hospital for COVID. So the impact on the individual may or may not be different. If you have another condition, having COVID potentially will exacerbate and complicate that other condition, but the impact on the hospital, on the National Health Service, is not as different as people try to suggest. The bed that is occupied by somebody with COVID is occupied with infection control measures around it, whether they're in because of COVID or in with COVID. So yes, let's understand this, but for goodness sake, let's not overstate the importance of that differentiation in terms of the impact of these admissions on the National Health Service.
Anna Sarwar.
I'm not sure the First Minister deliberately confuses the issue. No one is questioning whether having a patient with COVID impacts on hospital capacity, but what it does impact is on people thinking about how dangerous this variant is to them, their life and to their loved ones. So level of hospitalisations and levels of infection of those in intensive care due to the COVID outbreak is really significant and really important, and why people are measuring how they need to restrict their lives and how they live it and the impact it then has on businesses. So that data is really important, and people have been asking for it for weeks since Omicron broke out. So I think the urgency of it is really important so we can maintain public confidence in the restrictions being taken. So I would repeat the public health advice. The vaccine works. Please do go and get your vaccination if you haven't had your first, second or booster dose. If it isn't too late, there isn't any embarrassment, please book an appointment and visit a drop-in clinic. Please also follow the restrictions. Please do take lateral flow tests. Please do go for PCR tests if you are eligible for doing so. Another issue I raised last week was testing capacity, and I note the new arrangements on testing, but issues still remain for the wider population and key workers, issues around PCR capacity, but also supply of LFD tests. And across Scotland, key workers in NHS and beyond are reporting waiting days for PCR test results, despite promises of a fast-track service for frontline workers. A number of staff are having been in touch, saying they're delayed from going back to work for days as a result of that capacity. So given the new protocols on testing, can the First Minister confirm that LFD supply and distribution issues have been resolved? And can she clarify who is now eligible for a PCR test? If you are symptomatic after an LFT, for example, should you go for a PCR test? Will there be new guidance published around PCR test eligibility? And will the new freed up capacity be prioritised for frontline NHS and social care workers?
First Minister.
Let me take these issues in turn, and they're all important issues, so forgive me, Presiding Officer, I'll try to do it as briefly as possible. I want to give substantive answers. Firstly, to return to this issue of the distinction between people in hospital with COVID and in hospital because of COVID. Anna Sarwar's points are not unimportant, and I'm not suggesting they are, but I would also ask him on the point he's making about severity, equally not to oversimplify things. As I said in my statement, all of the evidence we have so far, including the evidence from admissions to ICU in Scotland, which are not rising at the rate that hospital admissions are rising, suggests that the impact on individuals of Omicron is less severe than previous variants. Now, whether that's an inherent milder version of the virus or whether it's the effects of vaccination, we don't know for sure, but all of the evidence points to that. But there's two caveats we need to make there. One is that is evidence that is based so far on the circulation of Omicron largely within younger populations, which throughout this pandemic have been less likely, not completely unlikely, but less likely to fall seriously ill. We need to continue to monitor that if the spread, as is happening now, moves from younger populations into older age groups. That's the first caveat. The second caveat is about volume. That even if the rate of hospitalisation, therefore the severity, is much less, the sheer volume of cases will add up to significant pressure, is already adding up to significant pressure on the National Health Service. And that is not abstract or academic for people's health, because if the hospitals are so full of COVID cases that they can't treat in the way they want to other conditions, heart disease or whatever other conditions, that has an impact on people's health. So even if not all of the people in hospital are in because of COVID, that does not mean that we should be complacent in any way for any reason about the mounting pressure on our hospitals. And I hope that is clear. I recognise the points that are being made, but I appeal to opposition leaders not to oversimplify these issues, because I don't think that helps anyone. On the issue of testing, we will, with community transmission as high as it is just now, we will periodically have pressure on the testing system, and we are working on a Four Nations basis because most of our testing capacity is through the Four Nations system, although we also have quite considerable NHS Scotland testing capacity. We work on a daily basis to resolve and to flex the the capacity as far as possible. Right now, there's no shortage in Scotland of LFD tests. We monitor the supply of those very carefully, and issues that we were seeing with turnaround times have improved again, and turnaround times have become much shorter again. The essential workers route to prioritise PCR testing is there. There's also the sectoral exemption process that is available to NHS workers and key workers in other sectors. And lastly, we will ensure that there is guidance on the latest testing advice, but I think I did make this point clear in my statement, but if I didn't, let me repeat it. If you have symptoms of COVID, then even if you've taken an LFD test that is positive, the advice is to still book a PCR test. It is only if you have no symptoms and your LFD test is positive that we're then saying there's no need to take a PCR test, not just because we're trying to maximise testing capacity, but because it is a pretty safe assumption, given levels of transmission right now, that you are positive, because the false positive rate is so low, and working on the basis of that positive LFD test allows the contact tracing process to kick in as quickly as possible. Obviously, if you have symptoms, there's a variety of reasons that we would still want PCR testing to happen, not least as we get more antiviral treatment to allow us to assess patients who are most likely to benefit from that.
I call Alex Cole-Hamilton.
Thank you very much, Presiding Officer. At the start of this pandemic, the government carried opposition party support for public health measures by providing us with almost real-time information about the advance of the virus. It meant that we were all signed up to the precautionary principle of hinging decisions around data rather than dates. But that transparency has ebbed away. 6 weeks of Omicron in Scotland, and we will only learn on Friday who is in hospital specifically because of Omicron severity, despite some of those details already making their way into the national press. If the First Minister is still leading the public health response to COVID on the basis of data and not dates, does she recognise the importance of being more transparent with the information she has if she's to bring us with her? And
firstly, the reason that I'm not sharing the data on people in hospital because of COVID versus people in hospital with COVID is not because I'm not being transparent, because I don't have that data yet, because Public Health Scotland are doing careful work to make sure that that data, when it is published, is robust and reliable. They published data on that question previously with the past variants of the virus, and they're doing that work again. So it's not trying to hide that data. We want to make sure it is reliable and that what is published is data that people can have confidence in, and it will be published on Friday because that's when Public Health Scotland consider they will reach that state. There's no point in publishing data that is not reliable because it doesn't help anybody. Beyond that, I'll continue to be as open and transparent as possible about data, about evidence, but ultimately, as I've said before, the data and the evidence doesn't make the decisions, it informs the decisions. The decisions have to be taken by those of us who are elected to carry that responsibility, and that does involve the application of judgment, and that is what I'm elected to do, and it's what I am held accountable for. But we'll be as open and transparent as we have been all along about the data and the evidence underpinning that, but I make no apology for wanting that data to be as robust as it can possibly be.
Gulhani, to be followed by Jackie Bailey.
Thank you. First Minister, the Scottish people are struggling under the restrictions that are in place, some of which have been in place for a long time. Look, we all appreciate that COVID necessitates some restrictions, but what information does the Scottish Government base its decisions upon? We simply don't know. And so to help the people better understand, and in terms of transparency, will you commit to publish weekly, ahead of the announcement, all the data the Cabinet bases its decisions upon?
First Minister.
We've published acres of data and evidence. We will continue to do that. But I come back to the point, the data and the evidence doesn't make the decisions, they inform the decisions. Look, I would hazard a guess that the member, who I know is a clinician himself, is in a minority of clinicians right now who don't think, or who think that no protective measures are required. Indeed, Scotland, Wales, Northern Ireland, many countries across Europe and the world are all in a similar place in some proportionate but necessary protections to try to stem, even to some extent, the rise in cases. And what is the rationale behind that? We know, particularly with Omicron, given its greater transmissibility and infectiousness, that large-scale events have the potential to quickly become super-spreading events, which is why we have, regrettably, put a temporary restriction on large events. We know that the kind of environments in hospitality where people come together, often poorly ventilated, with alcohol, lowering inhibitions, also raises risk of transmission, particularly with a greater transmissible variant. So that's the rationale for the particular targeted measures we have in place. We know from evidence that face coverings help, perhaps more than many other measures, reduce transmission. So actually, and I would expect somebody clinically qualified probably to understand this better than most, that all of these targeted measures that are in place right now are in place in many, many other countries, and all of them flow from our understanding of how a virus spreads, and in particular, given its greater transmissibility, the risks that the spread of Omicron presents.
Jackie Baillie, to be followed by Jim Fairley.
Contrary to what the First Minister said earlier, the Deputy First Minister did cite ONS data to justify his argument about how much better we're doing in Scotland because of restrictions here. The data he used covered the period up to the 23rd of December. That, of course, was before restrictions were introduced, when the rules were largely the same in Scotland and in England. Analysis by the Financial Times showed that the 7-day rolling average of cases up to the 3rd of January has Scotland with a higher percentage case numbers than England. ONS figures published today show largely the same level of infections in Scotland and England, other than in London. So I absolutely agree with the First Minister that this is not a competition, but would she agree with me that it is essential that ministers do not spin statistics and create misinformation which would weaken public confidence?
First Minister.
I don't think anybody's seeking to do that. It's not a competition, but since I've been asked these things, let me again. The Deputy First Minister cited ONS statistics yesterday. I didn't say he didn't. What I said was that he cited the most up-to-date ONS statistics, which until 2 o'clock today were the ones he cited yesterday. We have further data today that I've already cited, so I won't go into detail again. I would urge significant caution about the rolling average, 7-day rolling average of cases up to the 3rd of January in any part of the UK, because of the disruption to reporting over the Christmas and then the New Year holiday period, and the different pattern of testing we know is there when there is a holiday period. So I think I would treat those figures with significant caution. And also, as I've said, we know that the daily reported cases are a significant underestimate in all countries of the true prevalence of the virus. But if Jackie Baillie wants to make this point and get an assessment of the overall performance of Scotland to date, because it may change next week or next month, then overall, in terms of the pandemic to date, levels of infection in Scotland, and you can go into the UK government COVID dashboards and see this for yourself, overall levels of infection in Scotland are lower than, I think, in all other parts of the UK, certainly England and Wales. I can't recall exactly if that's the case for Northern Ireland. So does that say we've managed our way through this pandemic perfectly? Absolutely not. But it does suggest that the balance of judgments that we're taking, sometimes we'll get them more right than on other occasions. The balance of judgment have led us to that position. But I'm not complacent about this. We face ahead of us a really difficult period, and that's why my responsibility is just to take the decisions based on data and evidence, but applying my judgment, which is my job, the decisions that I think are likely to get us through this as safely as possible. And if they accord with decisions elsewhere in the UK, all good and well, but if they don't, then that will be for good reason that it is then my responsibility to set out for people and to allow people to decide.
Before I move on to take Jim Fairley, I have a point of order from Sandesh Gulhani. Mr Gulhani.
Thank you, Presiding Officer. I seek your clarification as to the fact that the First Minister completely misrepresented my position. At no point have I ever been against all restrictions. At no point have I ever been doing the things that I have been accused of, and that was absolutely not my question.
Okay, thank you, Dr. Gulhani. That is not a point of order, but your comment has obviously been recorded. I now move on to take Jim Fairley, who will be followed by Oliver Mundell. Claire Adamson.
Thank you, Presiding Officer. Last year saw education attainment figures, which even in the context of the pandemic, make a mockery of Nicola Sturgeon's promise that education would be her top priority. We simply cannot afford any more unavoidable disruption to learning. But can the First Minister tell us how many additional non-classroom committed teachers can be called upon to cover lessons? What other additional resources are being made available to keep our schools open? And finally, can she confirm that every pupil in Scotland now has access to an electronic device to support remote learning in the event that they're required to self-isolate?
First Minister.
I think possibly Oliver Mundell meant to ask me that we would ensure no disruption due to avoidable reasons, not unavoidable reasons. I don't want to see any further disruption to children's education because of the impact on attainment, not just in Scotland, but as any reasonable person knows, in all parts of the UK and indeed in countries across the world. That's why we are determined to keep schools open. We have already provided additional resources, so there are additional teachers already in our schools with plans to recruit more teachers. As a result of that resource, we have done what we have said we would do in terms of electronic devices to pupils, starting of course with those in the most deprived circumstances. In terms of the situation more widely, as I'm sure Oliver Mundell is aware, guidance was issued before Christmas to schools, basically looking at some of the things schools could do to make the environments as safe as possible. For example, how to minimise contacts through groupings where practicable indoors, tightening restrictions on school visitors, updated advice on ventilation and CO2 monitoring, updated advice on asymptomatic testing. But in relation to staffing, and I'm sure Oliver Mundell is aware of this, the Scottish Negotiating Committee for Teachers has previously agreed a number of contingencies for flexible staff resourcing to maintain continuity in education. So, for example, the ability, if necessary, to combine classes and stages, increase class contact time, or relocate staff temporarily. So those arrangements are already in place. And of course, our funding for additional teachers is already resulting in more than 2,000 more teachers in our schools than was the case before the start of the pandemic. And of course, right now, the ratio of pupil to teachers is at its lowest level, partly because of that additional recruitment since 2009.
Claire Adamson, to be followed by Gillian.
Thank you, Presiding Officer. 11 local authorities returned to school today, and school staff, pupils and parents are understandably anxious about what effect the Omicron surge will have. Many teachers will be opening windows to ensure adequate ventilation, but with temperatures close to freezing, this creates other problems. Will the First Minister consider deploying some of the money currently allocated to economic support to instead assist local councils to purchase air filtration units for classrooms which require them?
First Minister.
Of course, we'll continue to consider all suggestions like that. We have a separate fund available to help businesses with ventilation, so we will certainly look at the scope and the eligibility for that. We have already, as Gillian Mackay knows, provided councils with additional funding to do CO2 monitoring. Councils should already be acting on the outcomes of that to make improvements to ventilation, including air filtration systems where that is necessary. But we understand the impact on councils, and therefore will continue to talk to them about what further support we can provide. I think the other thing I would want to acknowledge is how anxious a time this is for young people going back to school, but also teachers and other staff in schools, and for parents. This is not the position any of us wanted to be in. I think for reasons we all understand, keeping young people in school with as normal a school experience as possible is really, really important. But that requires steps and mitigations to be taken to keep schools safe, or as safe as possible in the situation that we face right now. It also makes it important that those in the 12 to 15 age groups eligible for second dose of vaccination come forward to take that up, and of course we'll continue to pay close attention to future advice from the JCVI on extending vaccination to other groups of young people.
Willie Coffey, to be followed by Dr.
Thank you, Presiding Officer. Will the First Minister apologise to my colleague, Dr. Sandesh Gohani, for the blatant misrepresentation of his position?
First Minister.
I don't think I've got any need to do that. I didn't intend to misrepresent anybody. I don't intend to misrepresent anybody. But Dr. Sandesh was, as I heard it, suggesting that the restrictions and protective measures were in place, as he put it, for some time, lacked evidence. And I was saying, and I said, and I will say again, I thought particularly for somebody who's clinically qualified, the reasons for these targeted interventions was obvious, and so obvious that many other countries, all other countries apart from England and the UK, and many other countries across the world were implementing very similar measures. I heard what he said to me as indicative of him not agreeing with these protective measures. If that's not what he intended to say, then I accept that, and his position is as he's put on the record. But I do repeat that he, of all people, presumably understands the rationale and the evidence base for the targeted measures that are in place in Scotland.
Wishart.
Thank you, Presiding Officer. Dr Gilhani called for the data that underpins the government's decisions, the very data that the First Minister says she doesn't have. Rather than falling back on the weasel words that she did with my colleague Sue Webber, will she agree to go back and look at the official report of what Dr Gilhani said, and then come back to apologise to Parliament next week?
Thank you, Mr Hoy, and I will just take this opportunity to remind all members at all times to treat one another with courtesy and respect, and I call on the First Minister to respond to Mr Hoy.
And I always seek to do so, Presiding Officer. Look, the data what is the data? The data is published on a daily basis. We've seen over the past week an 87% increase in recorded cases of Omicron. We see today, published by the Office of National Statistics, the fact that 1 in 20 people across Scotland right now probably have COVID. It probably is a bit higher than that now because these statistics are from a few days ago. We're seeing a rising number of people in our hospitals because of or with COVID. And therefore, that's the data that informs the decisions. We also have developing data, which doesn't need the Scottish Government to publish it because it's published by people globally about the increased transmissibility of Omicron. That data is there and it's available to not just members of this Parliament, but to anybody across the country. And what we do is take that data and the evidence of the impact of Omicron and we apply our judgment to what measures will help us stem transmission. And as I've said, the increased transmissibility mean that involves, regrettably, restricting large, potentially super spreader events and trying to contain transmission in settings that we know have a higher risk because of low ventilation or the kind of behaviours that happen in those settings. So I'm not sure what evidence and data of this is missing. We continue to publish evidence, and the fact that many other countries are doing similar or the same as us suggests that it's not just the Scottish Government that thinks this evidence justifies those actions. Now, lastly, because I do take this seriously, these are important issues. We agonise over these decisions. I spend most waking hours and thinking, as is my job, about the right balance of judgment to apply here. And I don't try to misrepresent people, but I would also ask people to go back and listen to the member's question, and my impression from that question was that he was not in support of the measures that were in place. Now, that's legitimate, and I answered the question on that basis. If that was not the impression he was intending to give, then I accept that, and I hope he will accept in turn that I was not seeking to misrepresent him. I think we've all got more important things, frankly, to deal with right now because of the really significant challenge that the country is facing.
And Beatrice Wishart.
Thank you, Presiding Officer. Some people currently living with long